Evening. Today is June 27th, Wednesday, June 27th, and this is Ask the Therapist. My name is Natalie Ellis. I am a licensed professional counselor here in the Atlanta, Georgia area, and I'm here to talk to you about trauma. Well, let's start with the definition. What is trauma? A deeply distressing experience. It can be a serious injury to the body and or to the mind. And so a physical injury to the body, they call that trauma as well, but it's a medical injury or it's a medical trauma to the body. And then we also may have a trauma to the mind. And when it is a trauma to the mind, it can cause emotional and psychological distress. And excuse me, psychological trauma is when there is a damage to the mind due to the distressing event. So there's a multitude of situations or events that can create a traumatic experience for each individual, and for everybody it's different. Okay? In many cases, when you're experiencing a trauma, you often feel as if your life is threatened, or your body's threatened, or your beliefs is threatened, or is in danger. So a lot of times with trauma, it creates a feeling of feeling unsafe or feeling insecure. Okay? So individuals may experience psychological trauma through feelings of harassment, embarrassment, abandonment, abuse, whether it's physical, sexual abuse, neglect, rejection, domestic violence, natural disasters, war, medical conditions, mass violence, violence. And so not only can you experience the trauma by having these things happen to you, but a lot of times too, we get traumatized by witnessing things. So we may witness domestic violence. We could witness somebody getting hurt, or a violent crime. By witnessing some of that, that also creates vicarious trauma. And with that being said, I want to add right there, with social media and all the individuals feel as if they need to post violence that occurs to people and repost those things. And again, when these things are being reposted over and over again, the individual's violence, the crime, that itself can create trauma, as well as vicarious trauma, secondary trauma. So there's a thing called secondary trauma where just by hearing about someone else's experience, that may cause trauma to us, because hearing about it can create distress. But with social media, it's not as if we're hearing about these things, we're also experiencing it. When someone is videotaping or audio taping a live fight, so we're just as much a participant of what's going on as the people that are there live. And so those things also creates trauma. And so these are things that I want to make sure we address with a lot of the reposting of the incident with that young man, the 15-year-old, and the stabbing. Just hearing about it was traumatic for me, let alone seeing it. And so we need to be aware of that. Additionally, we can experience trauma by witnessing or seeing, hearing someone else's trauma, which is what we talked about, which is vicarious trauma. When trauma goes untreated, it will manifest itself into mental health issues. And so it's so critical and so important that we address the trauma that we are experiencing, or else it could become something even greater than what it is. Okay? So signs of trauma include having nightmares, reoccurring thoughts, insomnia, sad mood, anxiety. And I talked about anxiety last time, which is an intense fear. Hypervigilance, where the hypervigilance sometimes creates paranoia, mistrust, panic attacks. Some people numb out, some people dissociate, meaning it's almost like they go into their head when they're experiencing a trauma, when they're seeing a trauma. People may have flashbacks, reoccurring negative thoughts. Some people could begin substance abuse, feeling unsafe. So with traumatic experience, there's this insecurity of what's going to happen next. So feeling unsafe, trouble concentrating, isolation. So these are just a few symptoms and signs of someone that's experiencing trauma. Okay? We have diagnosis related to trauma. which includes a diagnosis such as post-traumatic stress disorder. There's various forms of depression, and a few weeks ago I talked about depression. So people with depression disorders may have had incident where they've experienced trauma, which creates a sad mood. Again, when things get untreated, it manifests, it gets bigger and bigger. Okay, anxiety disorders as well, and we talked about it, different forms of anxiety disorders, and acute stress disorder. Substance abuse, there's diagnosis of substance abuse that may happen as well. And so there's various forms of diagnosing that occurs when someone experiences a trauma. And so, again, it's important to seek help. Seeking help, breaking the silence, which breaks the shame, which breaks the stigma regarding mental health. So a lot of people may experience a lot of these things in regards to a traumatic experience, and hold it to themselves, feeling as if they're the only ones who may have experienced this. And that is not the case. Many times, a lot of other individuals have experienced some sort of trauma or some sort of abuse, neglect, again, going through the gamut of different traumas, wars, domestic violence. It amazes me. I work a lot with young women between the age of 25 to 35, and how, again, violence, abusive relationships, it's very, very common, and that itself could also create trauma. So again, recognizing those things, and again, the first step is the awareness and seeking the help. So once someone comes to me and says, well, they've experienced these things, part of course, with every counselor, the first step is assessment. So we do an assessment, get a history of what's going on, ask questions about symptoms, ask questions about different things going on with them, and then from there we come up with some type of treatment plan. We come up with some type of diagnosis. We come up with some type of clinical impression of what's going on with this individual, and here are some things that we think could help. Okay, and with treatment of trauma, there's treatment such as cognitive behavior therapy, and cognitive behavior therapy works with a lot of different types of mental health disorders and mental health issues. And CBT is simply that, cognitive behavior therapy. And again, cognitive refers to the mind, refers to how we think, which then impacts our behavior. Okay, so cognitive behavior therapy is all about helping clients become aware of their thinking and how it's impacting their behavior, and then vice versa. Behavior impacting thinking, thinking impacting behavior, and providing them with tools to become aware of these things and to recognize it and to intervene, cope, and deal with that. And so CBT is simply that, recognizing the thoughts and the perceptions, the beliefs, and how it impacts the behavior. And when we experience a trauma, we formulate a belief about that trauma. And with that formulation, then there's a theme in our minds, or a reoccurring pattern. And so with some people, it may be, I am not safe in this world. I don't feel safe. And so again, let's take CBT, cognitive. The cognition is, I don't feel safe, and there's a behavior that's going to follow that. And sometimes it becomes so unconscious, depending on how early the trauma occurred, how often the trauma happened. And so with trauma, what makes the trauma, how should I say, for each individual, what makes something more traumatic for them versus others? Of course, there's a lot of things. Sometimes we may experience a trauma was a one-time thing. Sometimes it may be an ongoing thing. It's repetitive. Sexual abuse sometimes is repetitive. Childhood sexual abuse may be repetitive for years. And so the way that the person managed to cope with that particular trauma is different than the individual who may have had it in one time. And so all that formulates patterns for us in terms of thinking patterns as well. And so when we do CBT, we also look at thinking patterns. Okay, there's another treatment that I also use called EMDR, eye movement desensitization reprocessing. And that's a research that's been used with a lot of veterans, military people, and dealing with trauma. And so it's pretty intense, that particular treatment. So I would recommend, if you want to know more information, to read up about it. But EMDR is something that's been helpful and effective with trauma clients. So that's CBT. Again, there's things like prolonged exposure, obviously psychotherapy, talking things through, helping the client process the feelings and things that they have going on. We also have, I do play therapy with young kids, depending on what's going on. We do play therapy to kind of play out the trauma. So there's different types of treatment models that can be used with clients. Again, with all of the treatment, it's about self-awareness, helping the client become self-aware of thoughts, behaviors, feelings, and how it all relates to them and to their behavior, and recognizing maladaptive thinking, maladaptive behavior, which creates also maladaptive emotions or emotions that may not always fit. And so being aware of these things. Of course, a lot of it is helping clients develop coping strategies and soothing strategies, such as deep breathing, mindfulness. Those are different things that we do. So a few years ago, back in 1987, there was some research done with individuals called the ACE study. ACE stands for Adverse Childhood Experiences. And so adverse childhood experiences, it looked at an array of questions that adult individuals had to look at, that talked about different forms of traumatic events. Have you ever been physically abused, sexually abused, ever been engaged in neglect, or you've ever been neglected, or ever witnessed a parent with mental health, in regards to undiagnosed or untreated mental health. So it asks different kinds of questions. And in the study, it shows that, in the questions also, did you experience this before the age of 18? And so based on that research, it shows that people who have a high ACE score, so with every yes or no, there's 10 questions, yes or no. With every yeses, it increases individuals' chance of having a mental health disorder. And so these are childhood traumas, because it's looking at experiences between age 0 to 18. Okay? And so a lot of untreated childhood traumas do manifest itself into adult life. A lot of times, again, individuals dismisses a lot of these symptoms, dismisses a lot of these experiences as a part of life, which they are a part of life. However, these experiences do at times create trauma for us. And when we don't do things about it, and we don't seek the help and support, it manifests itself into bigger issues. Okay? So, I wanted to really talk about traumas, particularly the vicarious trauma, because again, there's a lot of posts and videos of crime and violence and things out there, and I'm not sure how much people are recognizing how traumatic these things are, to look at it, to consistently hearing those things ongoing, how traumatic it could be to our mind and to our bodies, listening and seeing these horrific images. And so this is just a little bit of it, to give people some insight as to really being aware of what all we're watching, what all we're hearing, what all we're paying a lot of attention to, because those things do impact us. When we're noticing we're having a hard time sleeping, we have these images, or this increased fear, feeling unsafe, again, because violence, that's what violence creates, feelings of not being safe. And so recognizing that. And, I'm not going to talk too much about this as well, but there's, of course, systemic trauma that has gone on from generation to generation, which we also have racism that creates trauma as well. And so these are just different things, again, as individual to pay attention to, but also as a as a community to pay attention to. But definitely seek help. There are lots of individuals out there, counselors out there who are trained to work with individuals with trauma. Definitely taking this first step when you're recognizing that you're having a hard time sleeping, the sad mood, the anxiety, the intense fear, panic attacks, paying attention to our body, feeling unsafe, trouble concentrating, the isolation. When we're recognizing these behaviors in us, then definitely seeking the help. Okay, so this is just a little bit of information regarding trauma that I wanted to share with you all. And so those were some of the questions. I believe I tapped into all the questions that's been asked of me. But definitely feel free to contact me. Again, my name is Natalie Ellis. I have a private practice in the Atlanta area called Esteem Counseling and Consulting Services. So you can always go to my website at esteemcounselingservices.com. I have, of course, the Instagram page as well and a Facebook page, Esteem Counseling Services. So feel free to contact me if you need specific information regarding trauma. Thank you and have a good evening.